morning. I'm going to do an Ezpap. So the first thing I'm going to do is check the patient's charts. So after checking the patient's charts, I'm going to take the necessary things that I will need for it. And when I'm ready, then I'll knock on the door, introduce myself, check the patient's ID band for the name and date of birth, and then I will wash my hands, apply the appropriate PPE, and then I would assess the patient, listen to their lung sounds, and then get their vital signs down before the treatment, and then explain to them what an Ezpap is and what it will be doing for them. So here we have an Ezpap. So this is just going to open up your lungs. It'll help strengthen your lungs to be able to cough up any secretions that you may have, help you prevent any atelectasis, which is just anything like that can cause complications in your lungs that will impact your breathing, okay? So here we have the Ezpap. It's just a little small device. If you can't quite do it, get your breathing with the mouthpiece. We can get a mask to place onto this. So here, I'm going to measure out their inspired volume. So I'm going to take the pressure manometer so that way I can see where they're at. So what I'm going to do is I'm going to apply it to the little port here. And then I'm going to set it at kind of where I like them to be at when they do it. And then I will apply, so with the Ezpap, it will be connected to an oxygen source, so you'll hear some noise when you do this treatment, but don't worry, it's nothing that will harm you with anything with the oxygen. It's just to help get it's a positive pressure flow. So this is just going to help you, it's an easier breathing treatment for you. That way you don't have to do as much effort as when you're doing with the other ones, okay? So you connect it to the oxygen source, and then you connect it to the Thorpe tube over there, and you would start it at 5 liters per minute. You don't want to exceed too high. That way you don't want to exceed the volume of the patient. So when you're ready, so you're going to instruct the patient to hold it upright, not to put it upside down because it won't read properly. And then to instruct them just to hold it off to the side, not to occlude the back side, because then you won't get that pressure through there, positive pressure through there like you need to get the appropriate treatment. And so what I'm going to have you do is take a nice deep breath in and then exhale. Have a nice strong exhale, but you only have to breathe in out for like 3 to 4 seconds. So it's like a 1 to 3 or 1 to 4 ratio. So we'll do that a few times, and then I'll let you take a breath break and let you breathe normally. Make sure you're breathing okay, not feeling overwhelmed. And so after we do it a few times, then we can, if we're done with the meter, what you do is remove it like that. And this is disposable, so you can just dispose of that. And then if they're just doing a treatment with the Ezpap without the manometer, make sure you close the port. That way you don't get any excess air through the port. That way you know they're getting the appropriate flow that they need. Now with the Ezpap, this can also coincide with your nebulizer treatments. So you can have a T-piece on here, and you can have a medicine cup, and they can take their nebulizer treatment through an Ezpap. So when I'm finished, I would always remove the oxygen, shut off the oxygen, and then I would remove the oxygen tubing, set it in the appropriate place, and set this in a safe place so that way we can do a treatment here later on. So we'll do a treatment every hour with them. And so when I'm finished, I would reassess the patient, listen to the lungs, see if it's helping the patient's lungs, note anything if they cough up anything when they cough, and then I would check their vital signs. After I'm done listening to their lungs, wash my hands, remove my PPE, and then I would go and chart on the patient's charts what kind of therapy I did with them.